Hello, what should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Xarelto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then you need to adjust the dose and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically you resume Eliquis, Xarelto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you might need to resume your Eliquis Geroto Obedexa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis Geroto Obedexa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. Liver biopsy, what to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve. Even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manage your warfarin or the anticoagulant closely to have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobenol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take a lobenol injection, you need to follow your doctor who manage your warfarin or the anticoagulant instructions closely make sure you understand when you need to start the Lovenox injection. When you need to stop the Lovenox injection right before the procedure. When you need to resume your Lovenox injection after the procedure. When you need to completely stop the Lovenox injection therapy. If you are taking Eliquis or Yerotol or Badaxa, you should check your kidney labs. Make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Yerotol, or Badaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Eliquis, Yerotol, Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you might need to delay resuming your Eliquis, Yerotol, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulant so they can update the recommendation. If you have any question